Good afternoon, everyone. Thank you for joining us. My name is Julie Parker, and we'd like to welcome you to the September 2nd weekly Wednesday media briefing. Just want to point out for you all, we have been doing this each week since April. We're now in September, and as always, we are providing you access to the county executive, our county health officer, and as of late, our recovery director, the Office of the Emergency Management and Homeland Security Director, Dr. Earl Stoddard, is also on our line today. So as always, we will begin with the county executive.
So again, thank you all for coming in today. I want to start, I don't normally talk about the national scene and the national level, but I got to say something about something that the administration, a couple of things the administration has just done. And I want people to think about how these things fit together. We know that the president's been pushing everybody to go back to school, despite the fact that we know the kids are as active spreaders and capable of spreading as adults, despite the fact that we know that their infection rates are going up and the data shows it. He's insisting they all go back to school. Then on top of that, yesterday we find out from FEMA that as of September 15th, FEMA will no longer reimburse school systems for masks for children, which means that these masks on mass scales are not cheap. They do not last perpetually, so they continually have to be replaced. So basically, they're going to undermine the ability of kids to protect themselves in school, which means that since these kids come from diverse neighborhoods all over the place, Montgomery County is a great example of that. You are likely to get cases brought into school. You are likely to encourage the spread of disease in school if the kids aren't wearing masks. And then to top it all off, he wants to cut down on non-symptomatic testing, which means that you couldn't even test these kids to see if they were carrying, if they weren't symptomatic, which means they will be able to spread. And the people who they spread to will not get tested until somebody gets a fever, a sneezing, and is deemed to be worthy of getting tested. This goes beyond neglect. It goes beyond regular carelessness. This is actually a set of actions which is going to endanger the communities in this country, and not just Montgomery County. I assure you, we're going to continue to try to make sure we can get masks to the people who need masks. When the schools are ready to be open, we're going to make sure that the supplies are there. Hopefully there'll be saner people in charge when we get to that point. But we're going to make sure we can do these things. But people ought to put 1 + 1 + 1 together. It's almost like they're trying to drive this notion of herd immunity, that if I can get everybody sick, then the herd gets immunity. And if some people die, oh well. I don't have an oh well approach to whether or not some people die. I look at any death as an unfortunate and probably something, at least a large number, which could have been prevented. So I'm very disappointed with what's happening at the national level. I also want to say more locally, I'm a bit disappointed in the approach that Maryland is taking and going directly to phase 3. I guess I'm disappointed because none of the elected officials in the state got consulted on this. Nobody asked us, what do we know? What do we think? What are you hearing? What are you experiencing? And neither were the health officials. And so we're going into an area that is not being guided, from my perspective and from other people's perspective, by medical approaches, but more guided by a desire to reopen businesses. I get the desire to reopen businesses. I would love to have the tax revenue, but I don't want the tax revenue if the price to be paid is more sick people and more fatalities in our community. It is not worth it if you can't do it safely. So we are going to spend the next couple of days seeing what we can do differently. And what are the governor's guidance? Is there room for us to make steps forward? And where are the places that we're not going to go? So I won't say we're going to move into phase 3. We will continue to likely modify our phase 2, which we've been doing all along. I will, take full ownership. I wrote the governor a letter a couple of weeks ago after questioning the initial decision when the governor said you could have unlimited gatherings, but you couldn't have a musician or a comedian in front of these people. And I asked them when he first did this, what sense did it make to allow 250 people to gather together and then say if a band shows up, you all have to go home. That didn't make sense. Or somebody gets up and starts telling jokes, well, you can't have an audience for it. So we asked whether, in our case, where we limit gatherings to 50 people, could we allow a performer or performers, if they stay on the stage, if we don't allow crowds to gather in front of the stage, if we don't allow dancing, if we don't allow standing and congregating between tables, basically we continue to allow people to act as if they were in a dining establishment and follow our rules of distancing and mask wearing and allow people to perform and entertain. That's a request we got from a number of venues that had been doing it and wanted to continue doing it. And we finally got guidance last week from the state saying that we could do it, provided it was primarily done as a dining establishment. And so we will definitely modify our rules on the entertainment to accommodate something which we asked for. So it's not like we weren't asking for things to be changed. This is something we pretty clearly thought could be changed. And finally, the state agreed with us on that. But we have trepidation over some of the other stuff, and we're going to examine this very closely and continue to make what we think are the best decisions for the health of our residents. As always, I rely on Dr. Gales and Dr. Stoddard and the professionals that they talk to for guidance on what kind of decisions that we're going to make in the county. And I think that's what all of us need to do. Despite the impatience and frustration with where we are where we are. I know I'm one of those people who a few weeks ago, when our cases were down around 50 a day, and we thought that was a big check downward from 200 a day. And we felt like, well, this is a good sign, this will keep going. The truth is, it didn't keep going. And after things opened up more in the state, our cases have been closer to 70 a day. We've had a couple of days around 90 to 100. So we are not in a place that I can say, you know, we made progress and we continue to make great progress and let's open the doors. It is not party time yet. It is not a time to relax. It is not a time to say, we've mission accomplished, as some famous person once said. None of those things are true. We're making progress, that is true, but we're not where we need to be. And when we're where we are need to be, we'll all have a great celebration of being able to reopen things in a more normal way. But until we're there, we're not there. What else do I want to talk about? So 97 positive cases on Tuesday. Yes, on Tuesday, 87 cases today. Remember, these are reported for the day before. Our testing volume in the state is down. The totals are below 15,000. We had much higher testing volumes. So if you're seeing lower cases at the state level, they're also testing fewer people at the state level. This is one of the other scenarios which worries people. I can make cases go away if I don't test people. That doesn't mean they're not there. It just means that we don't see them. So we're trying to ramp our testing back up. And hopefully what's happening at the statewide level is a glitch and something that eventually will get to higher levels of testing. Our program, like I said, is back up and running. We've done more than 1,700 county issued COVID tests since Thursday. We have 2 clinics using CDC trailers. Today at Lake Forest Mall, there were 30 people waiting at 8:30 for the opening. Friday will be at the Wheaton Rec Department. Both these testing sites are drive-ups. On the average, the time for us to get specimens, specimen results back has been 62 hours. We're hoping that we can get this back and continue to push this below 62 hours. It would be good to be basically on 24 hours so we can very rapidly get ourselves on the trail of the contacts that people have had. You got to remember, every day we don't know whether somebody's positive is a day that we don't know whether that person's spreading. And so the sooner we get control over this, the better off we'll be. We all continue to feel that public schools and schools in general are really not safe to open. I was just told that JMU reported 500 cases, and that they were closing and sending people home. It is very hard to control where everybody's been, whether it's the faculty, the staff, or the students and their families. And so the notion that it's just the school doesn't take into account the fact that the people going into that school may have vastly diverse experiences in the community. And we continue to think not a good idea to go there right now. We do understand the guidance that's coming from the state, and we're confident that the school board will continue to make the best decision that they need to make, taking into account the safety of their staff, their students, and the community at large. So I think I'll stop there. Thank you.
Thank you, Mr. Executive. Dr. Gales.
Good afternoon, everyone. Always a pleasure to be with you. I'll keep this concise to allow for more time for questions, but a couple of things just to remind folks of, as the county executive mentioned, we've talked about this in a number of our briefings over the last couple of weeks, that we've had a number of days where we've seen decreased test volume in terms of the tests being resulted. And we're starting to see that become more common. So for example, yesterday, the test count was out of 13, a little bit over 13,000 tests resulted. Today, just shy, a little bit over 12,000. So we're continuing to monitor that trend, and we're continuing to try to understand what's driving that. And that's not only, necessarily here locally, but across the state, to get a better understanding if it's a question of access to testing, testing fatigue, or people just simply aren't showing up to get tested based upon any of the recent conversations about guidelines. And so it's important to understand when we look at the total number of results resulted, we also look at a host of those other measures, test positivity, and the number of tests that it is out of. Now, another thing I want to highlight, which we've talked about before, is the percentage of cases in the younger groups, the 0 to 19-year-old age group. In Montgomery County in August, we saw approximately 19% of our new cases who were in that age group. And in fact, of the results that were reported this morning, we saw over 22% of the new cases reported today being in that 0 to 19 age group. And this is on the heels of a study that was released in the New York Times on August 31st that talked about and showed the number of cases in the pediatric age groups since May through August. And they actually showed that the number of cases in children increased by 720%, the number of hospitalizations increased by 356%, and the number of deaths increased by 229%. So this is not to scare anyone, but also to, again, remind folks that we are seeing more cases in our younger age groups, not just the 20 to 30-year-olds, but also those school-age children. And for the folks, as the county executive mentioned, we are seeing cases pop up in college campuses and students are returning home. I want to make sure that folks understand when they come back, if you are coming back home, the expectation is if you have been identified as a potential contact and exposed, it is fully expected that you take the necessary precautions to quarantine yourself, get tested, know your status, and minimize your exposure to other individuals to mitigate any further transmission. The last thing I will say is get your flu shot. Flu season has already begun, and just want to remind folks it's not too early to go ahead and get your flu vaccine this year. Thank you.
Thank you, Dr. Gales. Dr. Stoddard.
Yes, I too only have a few updates so we can get the questions. So we did have a productive meeting with our non-public schools on Friday afternoon. It came one day after the governor of the state released its guidelines. We are still looking for some clarification on those guidelines and where there are gaps in clarification or recommendations that we can also provide to the non-public schools. We're going to continue to have a series of those webinars like we had last Friday. The next one will be on September 11th. Our Community Recovery Advisory Group meets again tomorrow evening. We're going to look at election preparations as well as our economic revitalization efforts in our recovery framework. They've been a very productive source of feedback to representing a broad swath of our community to ensure that we're doing things in recovery the right way. On recovery, we're working on what we're calling the For Business Assistance Center. This assistance center will offer technical assistance to businesses throughout the recovery work that we're doing from the pandemic. Things like how to renegotiate leases, how to operate in digital environments, things along those nature. This is an ongoing way that we're going to continue to support our businesses. We know that people are struggling. We want to make sure that they have as many resources and as much information as possible on how to be successful. And finally, I do want to talk just a little bit about elections. We continue to staff up and prepare our Board of Elections to both conduct the general election in November, or I guess beginning in October, but into November, but also make sure our facilities and make sure that we can get through the absentee ballot applications that are coming in fast and furious. And so we want to make sure we have enough staff to address those and get those turned around very quickly. We continue to encourage people to request the ballot by mail. Obviously, printing the ballot off the internet does pose a additional logistical challenge for us, in that it has to be transferred over to the form that can be read by the ballot counters. And so obviously, the closer we get to election day, the requesting of those printed versions off the internet poses a greater risk that the ballot will not actually be physically counted on election day. And that's obviously something that everyone wants to see happen. So we continue to encourage people to request the ballots by mail and complete them that way. So with that, I think I'm finished up.
All right, thank you all. We have a long list of reporters, many of whom have multiple questions. So for the reporters, please keep your questions as tight as you can. And speakers, take as much time as you need. Chris Gordon with Channel 4 is up first with questions for the county executive and Dr. Gales.
Yes, thank you very much. You say that, Mr. County Executive, that you have been surprised by the governor now twice, last week on in-person schooling, and this week on phase 3, beginning phase 3 reopening. The question is this. Why do you think the state is not coordinating with counties, seeing that they're giving the counties the right to make decisions? Why aren't they giving you that information before they make it public and surprise you? And number 2, when do you think Montgomery County and how, what are the guidance, what's the guidance, what are the timelines for when and how Montgomery County will adopt this phase 3 that the governor announced?
Okay, you've been at these conferences, like Julie said, since April. We don't operate by timeline, because if I have to stick to a timeline and the conditions aren't right, then the question is, why didn't you do it? You'd said you're going to do it on this date. And that's not the way you make health-based decisions. You make decisions when you get to the point where you think it's safe to do. So I can't give you a timeline. I will tell you that, like I said, I was optimistic when we saw cases getting down to the 45, 50 range. If they had continued to go down, and I've said this before, I don't expect to get to 0, but I expect to get below that number. I know when the governor pointed out the states to the north of us that has opened up, I will note again that Maryland doesn't match any of the metrics that those states have opened up, have been able to achieve. If I had the metrics that New Jersey and New York and Connecticut have in some of in these cases, we'd be having a different discussion. But those aren't the metrics we have. So our goal is, if New York, New Jersey, and Connecticut can get there, we can get there. And when we're there, and as we get closer to those numbers, then we will open up more and more things. But we're going to continue to be careful, and we're going to continue to avoid high-risk activities. Some of the states with the worst cases now that jumped ahead to phase 3 were cases that were states that had lower loads than we did at the point they made the decision that it was party time again. And they suffered woefully for that, and their people suffered for it. So we're going to be careful. I think that's what people expect us to do. Most businesses are able to be open, even if to a limited degree. I've been always willing to look at ways of letting people do more if it can be done safely. Part of it, we rely on other people to actually follow the guidance we give them, because we don't have the capacity to be in every business or every school saying, this is the guidance, I'm going to make sure you follow it. And that's one of the problems. We can say one thing, it doesn't mean that everybody does the things that we're asking them to do. As we found out on late night entertainment and what happens in bars after the food goes off the table. So we'll be careful. If you like metrics, I like the metrics that the states to the north achieved. And if we get closer to those numbers, I think I'll feel better about doing more things. But again, I defer to Dr. Gales on more wisdom on this.
And Chris, you had a question for Dr. Gales? You're muted. Hang on. There you go.
Yeah, I just wanted him to follow up, as the county executive said, as to what, if any, guidance we might give the public as to when Montgomery County, we're expecting to hear from Prince George's County tomorrow. What can we hear from Montgomery County in terms of the metrics or timeline of phase 3?
Sure. So I would caution, as opposed to saying it's going to be moving to phase 3, as the county executive mentioned, we're going to continue to look at a host of activities that we have in place already and others that may have been allowed with the most recent governor's guidelines. Look at our surveillance data to determine if it's safe to do that and make any adjustments. My expectation is, based upon our conversations, is that we would provide that guidance to folks before the Friday go live date with the governor's phase 3 plan, so that they can plan accordingly.
Chris, hang on. Chris, you're on mute. Hang on.
Yeah, I just wanted to clarify. Did you say, Dr. Gales, that you're going to provide some guidance before this Friday, going into Labor Day weekend?
Yes.
So what can we expect going into Labor Day weekend?
So as we've said, as the county executive opened, and as I just said, we are going to continue to look at and study the different activities and be able to provide guidance where we feel it is safe to potentially move forward. And also if there are other activities that have been allowed and are permissible based upon the governor's directive that we don't feel are safe to move forward. So we're going to continue that. Keep in mind, we received this guidance late yesterday afternoon, and in fact, weren't able to see the guidance in a paper format until late yesterday evening. So we're going to continue to work through today and tomorrow, and I'm sure our wonderful comms team will be notifying you once we're ready to deliver that information to you all.
Okay, Ike with Channel 5 is up next with a question for the county exec and Dr. Gales.
Hi, how you doing today? I know you've said that you based this reopening on a scientific approach. Before you said you never wanted to hit 70 cases a day, but I'm looking at Virginia. They've been in phase 3 since July 1st. That's literally 2 months from now. All over Northern Virginia, Fairfax City, they're at 98. Yet Alexandria, they're at 20 new cases a day. I just want to know, what's the threshold for opening back up? Are there figures that you're waiting for? I know you said it's a rolling basis, but what can the public look to? And where are you getting those numbers from? And I have another question.
So we've actually been very clear from the beginning, and I want folks at home to understand, is that we look at a host of things. We don't make any of these decisions arbitrarily. We look at a host of data reports from a federal, state, and local level. We also consult with experts at the federal, state, and local level to help get input. In particular, we pressure test ideas and say, hey, based upon your expertise, based upon the information that we're receiving, are we making the right steps? I don't sit in a room and decide, here's what we're going to do, and we run with it. We have very thoughtful conversations that's guided by a host of resources and guidance. Now, when we look at those standards, as we've talked about before, they're different thresholds. And so, for example, we've talked about and it came up in the subject of non-public schools, we talked about different thresholds related to low transmission and moderate transmission. And by definition, when we've looked at those thresholds, we've also looked at the guidelines that talk about, in order to move to a new phase, you have to have sustained improvement in metrics over a certain time period. And we've not necessarily achieved those things. So if the folks at home are looking, I would encourage you to look at some of the citations that are on the CDC website that give information related to those definitions, as well as look at the state dashboards, our dashboards, as well as the county executive mentioned other states in terms of looking at best practices to move forward.
Yeah, but Dr. Gales, I'm looking at that dashboard right now, and it says that there have been a decline across the board for 3-day averages of cases, deaths, hospitalization in ICUs. There's been a 3-day decline, and you said it yourself just now that you take notes from the state. The state is saying open up. So when you're taking notes from the state, what are they saying that's not in line with what Montgomery County wants to see?
So actually your depiction of the information is inaccurate. the averages for average cases have not decreased every day. We actually haven't achieved that. And when we're looking at the information, in fact,
It says that on
today
the Montgomery County dashboard,
actually, if you just allow me to finish, when we look at the information today, we've actually seen an increase in our test positivity over the last 3 days. It went from 2.4 to 2.7%. We've seen the 3-day average had, from a mathematics perspective, had to increase because we were in our 60s for 2 days. And the last 2 days, we had a case total of 97 and 87 today. So again, that depiction in terms of those numbers haven't decreased. Now, what we're saying is, we're not saying is that, you know, our cases have spiked up, but what we are saying is we've plateaued over the last month where we are, and we haven't seen a continued improvement in the numbers to suggest that we add on more activities that would increase the potential contact and increase the potential points of potential transmission that could potentially cause a significant increase in cases. You are accurate in the depiction of the other measures, and we're happy to see that in terms of we've not seen a congruent increase in our hospitalizations and COVID-related illnesses. And so we will continue to monitor those. But, you know, we also want to be mindful that, you know, an increase in cases is an increase in cases. And, you know, we have to continue to think about where those cases are coming from, continuing to emphasize the strategies we have in place, as well as, you know, continue to look to see and identify if there are other potential causes that we've not addressed that we need to step up to the plate and put in policies to do so.
Okay, thank you both. Tom Rousey with Channel 7. Did you want to say something, Mr.
Yeah, I just wanted to add that, you know, we have the benefit of looking at what's happened around the country. And like I said before, there are places that once had better numbers than us and didn't think this was a problem. They went to opening, and the more they allowed contact and the more they allowed things that put people at risk, their cases blew up. That wasn't an accident. It's not like the virus is not like a bacterial infection, just is growing and growing and growing and waiting for you to get it. It only transmits from people. And so we have a pretty clear view that people are the main problem here in the worst possible way. I mean, we're the ones that carry this thing. And so when we see persistent cases, and if you like our numbers, because, you know, everyone likes Montgomery County's numbers, you look really good. They look really good because of what we did. It didn't happen by us doing what everybody else did. It happened by us setting a very deliberate path to be as careful as possible. So our numbers got where they did by being careful. And we're going to continue to be careful, because I don't want these numbers going back up. They've gone up a little bit. It's not that catastrophic rise we've seen in other places, but we're trying to make sure that now that we've got a higher level, that we can drive this number back down. I think we can do it, but it does require patience. And I understand people's patience is limited, because this is a very frightening and unpleasant situation for people to have to be living in. But it's what we're all dealt with right now. Look, you're working from home, right? I see your kitchen behind you. You know, obviously you're not going into a building full of people and doing your job. So, you know, to the extent we can prevent everybody else from having to do more contact than they need to, that's what we're trying to do.
All right, let's go to Tom Rousey, who's in his car with Channel 7 with a question for the county exec and Dr. Gales.
I got two questions. First one's for the county executive. It seemed, based on your statements, that you're open for, say, movie theaters, community theaters, music venues, to do outdoor things now, but not necessarily indoor. Is that correct? Or just give me your kind of an explanation of what you're thinking along those lines.
So on the entertainment stuff, you know, we were going to allow, you know, if you're in a restaurant and you've got a stage and you want to put a band up there, or you want to have a comedian up there, you're going to be able to do that with still the same capacity limits and the same rules about social distancing. Like I said, when you thought about the governor's order, once you allow a certain number of people, as long as you maintain distance and all this stuff, it doesn't matter if a couple of them are singing or telling jokes. We're still going to limit the outdoor gatherings, because there's way too much evidence that says large gatherings can be the trigger for, you know, spikes in infection. So we're going to keep our gatherings limited. And that would include if there's an outdoor ban. So, I mean, I imagine there'll be places that will have outdoor entertainment, but there will be limits on how many people can be there. And we'll be able to see, hopefully in not too long, what the effect is. Do we trigger any additional cases? Does contact tracing show us that, I can identify X number of cases coming out of an event, which would reinforce the idea that that event was a trigger. And as we learn more about that, then we'll continue to look at how we refine our decisions. But there is no experience with this anywhere. So we're trying to learn from everybody else and ourselves.
What about a straight up community theater, movie theater that's not a restaurant? What are you considering them to be allowed to do?
We haven't had a detailed talk. The governor would allow, 50% capacity up to 100 people. So it's either a maximum of 100, or if your capacity was 100, then it's 50 people you'd be allowed to have. It's the lesser of the two, as I understand it. So that's something we'll look at. We haven't made any decision. Like Travis said, we got this last night, and we haven't had time to digest it. I just got guidance on the on entertainment after asking for it for months. We got a letter at the end of last week, finally, where they said, yes, you can have entertainment, but this is what they said: you can have entertainment only in a restaurant setting, and not as a pure entertainment venue. And if the restaurant ceases to be serving food and functioning as a restaurant, then they can't have entertainment. That's the guidance I got last week. So 3 days later, with no warning, I'm getting a different set of guidance. And our health officer was no part of any discussion that would have led one from one place to another place.
And Tom, you had a question for Dr. Gales?
Yeah, just want to clarify something that you were asked earlier, but when you're saying you will have guidance before Friday, does that mean you will have these specific, this is what we will allow, this is what we will not allow, or will still be some decisions not made by Friday?
Our intention is to be able to provide full comments, for our local residents based upon the governor's guidelines, and provide some distinction within which activities that will be permitted within Montgomery County and those that won't.
Okay, thank you very much. We've got a long list of reporter questions. Caitlynn Peetz with the Bethesda Beat has a question for Mr. Elrich.
Hi, good afternoon. My question for you, Marc. Last week, you spoke at a community forum and mentioned that the county is considering taking contact tracing efforts back from the state. Can you just elaborate on what you meant by that? And the second part of the question would be, have you had any issues with getting contact tracing information from the state?
So we play a secondary role in the state's contact tracing programs. They have the primary program, we're the secondary support role. Myself and other county executives have tried to get more refined information, and we have not always been able to get what we think we need. I mean, I don't want to diss the information we have, but there are weaknesses in what's being presented in terms of our ability to determine what does the data actually tell us. And we'd like to know more specifically what the data tells us. So if we set up our own tracing protocols and tracing questions, I'm hoping we can get to a finer grained detail, which would benefit everybody. So that's a discussion that the county executives are having. I'll be on a call with them this afternoon. I wasn't the one who raised it. There are other executives who feel the same sort of disconnect or incompleteness about the data we're getting.
Okay, I've got a couple of questions from Rebecca Tan with the Post, who's having audio issues. I'll start with this one. Governor Hogan seemed to suggest yesterday that he thinks several large jurisdictions in the state have been too slow in reopening. Do you think that Montgomery has lifted restrictions at an appropriate pace? If so, why?
Absolutely, we did things at an appropriate place, and our results kind of show that. There are counties in this state that have, cases per 100,000 that are approaching 15. we've managed to get our cases down and our test positivity down. I think there was a point when Montgomery County and Prince George's County made up over half the tests, over half the cases in the state. That's no longer true. So I think our more cautious approach has made Montgomery County and I think Prince George's County safer. And I don't know what other metric you would use. It's certainly, this is not a crowd satisfaction game. This is, are you doing things that seem to be reducing the numbers? We seem to be doing things that are reducing the numbers.
And a second question from Rebecca. Are you concerned that the rest of the state moving to stage 3 will have repercussions on Montgomery? If so, what?
Heck yes. Look, I thought what happened, is it Worcester County where Ocean City is? And the high number of cases and the number of businesses that got shut down over there because of the way they opened up. We have no way of knowing how many of those, this is one of the things I'd love to know, is how many people who got COVID had a vacation in Ocean City. You would think that would be data that would be readily available and we talk about, but no one has mentioned, these many cases are traceable back there. I think that it just behooves us to be careful. And I think if people open up around us and, the jurisdictions that opened faster than we did, they're now bearing the heavier load of the cases. I can't say that there's an absolute correlation between those two things. There's no data certainty on that. But it is true, we don't exist in a vacuum. There's no wall around Montgomery County, no wall around the DC metro area. So our people go back and forth and across borders. And, unfortunately, unlike Vegas, what happens someplace else around here doesn't stay someplace else. You bring it home. We worry about that.
Okay, Matt Blitz with DCist and WAMU. Are you on the line? Do you have good working audio, Matt?
Yes, I do. My question is for Dr. Gales. With Avigenics announcing last week that they've met the asked for criteria, has there been any thought on recontracting with them for testing in Montgomery County?
So as to your question, we've still not received a formal report from CMS or the state. And from my understanding, the state, unless there's been an update within the last 24 hours, the state has not made any changes to their cease and desist order. So we will continue to, wait for those updates to determine any future steps as it relates to that.
And then I bounced around, WTOP, please forgive me. So we've got Kate Ryan and Jack. Kate, I see you've got 3 questions for each of our speakers here today. Could you start with Dr. Stoddard and Gales, and then we'll come back to you for your 3rd question just to get everyone else in?
Or I can make them real quick and rapid fire. Would that work?
Good deal. Good deal.
Very quick. Okay. So for Dr. Gales, I know you've been over and over this, but I think I know my readers, listeners are going to go, I'm sorry. So what are the numbers? What do we have to do to get to a point where we could, easily get into phase 3? So again, I'm looking for numbers if I can. For the county executive, are you hearing from any specific businesses? I'm wondering if AFI or movie theaters are going, come on, let us open. And what do you say to people who go, but Howard County is reopening? You've addressed some of that, but I'd like that addressed. And finally, for Dr. Stoddard, your meeting with non-public school leaders, what was discussed? Are we seeing any other cases from non-public schools? And that's it.
So I guess I'll go first. So to your point, Kate, actually it's an important teaching point to the folks at home. And to remember is getting wrapped up in numbers. So we've talked about the concepts of low transmission and moderate transmission, and we've thrown out those numbers. So moderate transmission for us is somewhere in the mid 30s on a daily basis, and low transmission is 10 cases per day. And one of the reason why we don't assign a particular number to a flex point is because you can imagine the first day where we see, well, we have 35 cases, let's run to phase 3. In order to be able to have numbers decrease, you have to acknowledge and see a place where there's improvement. You have to sustain those improvements over a period of time, because otherwise it creates a false sense of security that the viral load has truly come down. So having 1 or 2 days of cases in the 30s does not mean we have achieved that sustained improvement to drive the viral load down. And this actually gets back to the question that Ike asked earlier, is this is the reason why when we talk about improvements, we talk about it needing to be sustained over a period of time. And so if you're looking for numbers, I would prefer that you look at concepts and larger picture in terms of low and moderate transmission, because that varies by jurisdiction. And so when we're looking at hours, again, that's approximately 35 cases per day for moderate transmission and low transmission being 10. Let me also just emphasize and remind folks is that think back to March where we closed businesses down. Think back to March when we closed schools down. We were averaging 4 cases a day. We're in a much different place. And so when we're talking about the concepts of reopening, we're reopening at far higher rates of viral load, even though they are much better than where we were in the months of April and May and June, and actually even in July to some degree. Actually, not so much July. We actually have increase from July. We're still at much higher numbers than where we were when we closed things down the first time. And so we just want to make sure that we continue to be mindful of that, because as we open up more things, that increases contact points and networks of transmission. And the higher the viral load is in our community, the more likely it is and the easier it is for it to spread to individuals and see a significant increase in cases.
Okay. Real quick, the sustained period, do you need to see like 10 cases per day over 2 weeks, over 3 weeks, over a month?
Oh,
Dr. Gales will unmute himself.
So again, to repeat what I just mentioned, I'm not going to give you a nailed down number. The concepts are very clear and they've been expressed by the CDC and the state and us, is that typically when you look to moving from one phase to the other one, you should see sustained improvements over at minimum a 14-day period before you move to a new phase. And when you get to smaller numbers in terms of driving down from 70 to, we've talked about this before, the scientists and experts will say it's easier to drive from hundreds of cases to the 70 range, but it's harder to actually drive it down even more. And that's what we've been continuing to work on since July. As the county executive mentioned, we did actually dip down to where we saw a couple of days where I think we had a case total in the high 20s and a few days in the low 30s. And we'd love to get back there as soon as possible. But in terms of really moving forward to a fuller reopening, we need to see those types of numbers on a much more sustained, prolonged basis, extended basis.
So,
Executive, do you remember your question?
Yeah, sort of. It's sort of the same thing. Look, it's people are looking for a number, and the number is only the result of things you do. And so if I achieve that number, suppose we said 5 per day, 10 per day, and we achieved it, it would be as a result of stuff we did. That is not a reason to stop doing what you were doing, because it almost guarantees that if you don't do the things that puts the number down, that you're going to wind up with bigger numbers again. And so I hate, I feel like Travis does about this, I hate being driven by folks who only want to talk about numbers and what number. It's really, does the number get down and then stay there? There's not a treatment for the virus. So if cases are going down, it's not because we've treated it. It's not because we've beaten it. It's because the policies in this county are probably the most restrictive in terms of contact between person to person. We are probably among the most restrictive, not as restrictive as we could have been and probably should have been early on, but we're among the most restrictive. And being the most restrictive has limited contact. Limited contact, we know, limits the virus. So our numbers are only as good as our ability to limit contact. So to think that you achieve this magical number and then all of a sudden you let up on the contact, that you really, we're not in a position to do that until that number is small. It is too much for me to look at 50 to 100 cases a day because that means every day somebody's going out and getting infected by somebody. If this were a one-off, that'd be one thing, but the persistence, the inability to keep the number down around 45 or 50 and to be looking at 70 and to know this is day after day after day tells you that the virus is still out there and that we have some control on it because of our restrictions. We don't have as much control as we'd like. I can't speak for what other jurisdictions do to make their decisions, but I know what we're trying to do, and I trust the approach that we're taking. And I think our results kind of speak for themselves.
Thank you. Dr. Stoddard.
Yes, so on the question of non-public schools and last Friday, to be clear, we scheduled last Friday's meeting prior to any knowledge of or release of the guidance that came out on the previous evening that we had at Thursday evening. So our scheduled meeting was focused on contact tracing and reporting, which were things that are established within state law and COMAR long before COVID-19 was a thing. And so what we talked about on Friday with our non-public schools focused specifically on their requirements around reporting of cases and describing to them the process that public health will follow in following up on those cases, how they'll conduct their investigation, the kinds of information that they would be expecting the schools to help provide them, what the role of the school is in conducting that investigation, things of that kind. Now that we have what guidelines were provided last week, we can, our future sessions, I think the next one will be on September 11th, we'll focus on different elements of those guidelines and address different topics that come up that we've heard a lot of questions about. To be clear, the one thing that we did get from the guidelines and that there's still some ambiguity around is the state has set this threshold of 5% positivity, which we do meet. But below that, there are sort of a spectrum, I'll call it, of opportunities based on some number between 15 cases per 100,000 and 5 cases per 100,000. We don't get down to the 5 per 100,000 that the state has already designated for full in-class education. However, what isn't clear is the definitions of what hybrid education means to the state, the definitions of what limited in person or expanded in person. Those things are not defined within the state guidelines. We have asked them for further guidance on what those things actually mean. In addition, how they measure the numbers will be important because obviously we want to mirror that information from our local perspective around, is it a 7-day rolling average every 14 days? Is it, what is the period of measuring of that daily case burden? Because obviously if you look at daily case totals on any individual day, it can be up or down significantly. It just has to, how they want to measure that is really important to us. So those are some examples of things that we're still looking for some clarity on that will allow us to move forward. Again, next meeting will be September 11th.
Thank you, Dr. Stoddard. And Jack Moore with WTOP has a question. Advogenics. Go ahead, Jack.
Yeah. Thank you. Okay, I've heard from 3 people who were tested at county-run sites in early August and who actually never received results at all because their tests were still in the process of through that process when the lab was ordered to halt operations. And all 3 people I spoke with said they were disappointed that they didn't hear directly from the county about the issues at the lab and that they wouldn't get results. They realize now that there was a press release issued, but these people, weren't signed up for county press releases and they were waiting for weeks for these results that never happened. And, then they days later saw a news article like, oh, this lab was suspended. I'm just kind of curious, what's your response to those frustrations from people? And do you think the county did all it could have done to alert people who were, directly affected in not receiving a test result?
We apologize for any frustrations that folks experienced in terms of the delays associated with the lab. I'm not a communications person, but we did make every attempt to notify the broader public when we were notified. We were first notified. We suspended testing for their county apparatus. And then when we were notified of the cease and desist order, we did make broad announcements in terms of recommending that individuals who have been tested within that 2-week period to get retested, as we were not sure of the results that would be coming back. And so at the same time, we take full responsibility. We will work to, hopefully we won't have a situation like this happen again. So I won't say that we will make those adjustments next time, because hopefully there won't be a next time. But if there are any individuals out there who did experience issues with that and would like to get retested, please call our disease control number and we can get you scheduled and make sure you have the necessary provisions and access to those testing platforms.
And that number, Dr. Gales?
It is 240-777-1755.
Thank you. And thank you, Jack. Randi Bass with WDVM is our last question of the day for Dr. Gales as we approach the 1-hour mark here.
Awesome. Thank you guys so much for getting my question in. Good afternoon, Dr. Gales. In your opening remarks, you said that Montgomery County and the state of Maryland are both seeing decreased testing volumes, decreased numbers of folks coming in to get tested. You said some people are looking into this. And at this time, what do you believe is driving that trend?
Well, so actually, our testing numbers overall for the county are rebounding. For example, out of the just shy over 12,000 tests that I mentioned that were reported from yesterday that were resulted, we had over 2,800 of those within our jurisdiction. And we continue to, scale up our county portion of that through our increased testing opportunities over the rest of the week. So this, it does introduce a concept that we as a local jurisdiction, the state, as well as the national the whole country have to look at, because we have seen a dip in the number of folks getting tested. Now, we speculate, we don't have any final answers, but we speculate that part of that could be due to recent guidelines that from the CDC that muddied the conversation, that suggested that asymptomatic individuals should not get tested. And so we don't know the impact on, one, if that told people who were asymptomatic, okay, maybe I don't need to get tested. And on the flip side, maybe influence providers' willingness to offer tests to individuals who weren't demonstrating symptoms. So we have to continue to look into that and educate people. From our perspective in Montgomery County, we still recommend folks, as many people to get tested as possible, and don't support those limitations and restrictions on testing criteria. We lived through a phase early on in the pandemic where there were significant restrictions on who could get tested due to availability, and that put us in a bad situation because we missed a lot of potential cases that went on to infect other people. So, and the second part of it is just making sure that we continue, not only locally, but regionally and a state level, continue to make opportunities and testing opportunities accessible and available to folks. And so that's continuing to look at other strategies in terms of where people can get the test, not only in terms of drive-up places, but making sure that they're walkable and accessible in that way, and also making sure that the tests are distributed, particularly in those zip codes and geographic areas where we see a higher number of cases.
And if I can, I'd like to just add that so much of the test volume is driven by the healthcare sector itself. And so when we see reductions, it's not necessarily the actions of a particular state or local government necessarily. When we see these reductions that we've seen, it's much more to do with a broader issue around testing that goes into our healthcare networks. Healthcare networks, even in Montgomery County, do something like 90% or more of the testing volume that we do every day. And so when we see these reductions, they're across the board, not driven by, these aren't event, it's not like you're canceling an event in each county every day and that's what's driving these reductions. We're talking about reductions that are, 10,000 or more tests a day, it swings. And that has to be driven by a connection to the healthcare system.
Okay, so if anyone is interested in watching this entire briefing, it will be available. Check our Twitter page in just a couple of hours, which is at Montgomery COMD. It will also be on our Facebook page, and we appreciate you joining us and tuning in each and every week. We'll see you back here next week. Thank you.
Get your flu shot, please.